already know about the gut-brain connection and that stress can impact on your digestive symptoms. But did you also know that other emotions might be changing your gut motility, maybe slowing down your stomach emptying or increasing your transit time? This week, I'm going to talk about those negative emotions that we don't really like to feel, but are very closely linked up to how we experience digestive symptoms. Your personality type might influence how likely you are to have IBS in the first place. I'll also talk about some of the things that I find helpful to discuss with my clients about how to manage emotions to get better digestion. Hello, welcome to episode 69 of the Inside Knowledge podcast for people with IBS. I'm Anna Mapson. Everyone experiences a range of different emotions. We sometimes feel fearful, we sometimes feel embarrassed, sometimes sad. Not everyone can interpret these feelings. Sometimes people really struggle to identify their emotions, and I'm going to talk a lot about this today, but I also want to talk about some of the particular feelings that we might have and how they're associated with irritable bowel syndrome. So we know that visceral sensations, emotions, and things that we feel can affect physical changes in the gut. So as I mentioned, not only just an increase in stress can activate that fight or flight response, but you may also feel some of the same physical changes through emotions such as anger, embarrassment, or shame about your body. And these can be quite prevalent in a digestive condition like IBS, where you are having to experience bloating, which may change your body shape, maybe smells and noises in the toilet that you feel embarrassed about. Perhaps you feel angry, like, why is this happening to me? And resentful that other people can just eat what they want and don't seem to get the same issues. These kind of things are really common because you're dealing with a chronic condition. And when you've had this for years and it has started to affect your life, it's no wonder that it affects your outlook, your experience of life, like maybe it's affecting your relationships, your social interactions, and even your work. So the purpose of today's episode is really to explore some of those things. There's no good just saying, just be happier, don't feel so stressed. That's not what I'm trying to say. I'm trying to explore a little bit with you what it means to feel these things and what impact it could be having on your digestive system. And then I'll also talk at the end a little bit about what you can do to try and deal with some of these emotions in a positive way. How we react to different emotions is very much built into our brains, into that primitive part of our brain called the amygdala, where we get that fight or flight response. It's like sometimes called your cave person brain, and that is the basic emotional response that helps to keep us safe. The way we experience the world builds up our sense of whether we are safe or not, and that goes right back to times when you're a baby. So before you were 3, a lot of this is pre-learned. Depending on your attachment to your parents or caregivers, that has got a huge impact on how you see the world and how you experience fear or security or anger or feeling calm. All of these things are almost like built in. It doesn't mean that if you've had a difficult upbringing and your childhood was either traumatic or you had some attachment issues with your family, that you are broken, that you can't fix it. It's just that understanding that sometimes these things are really deep-seated and deep-rooted in our brains, and it's not easy to fix, maybe just helps you to realise why you haven't been able to tackle it in the past. The first emotion I wanted to talk about is fear or anxiety or excessive worry. This is very common in IBS and perhaps is a feature of your IBS. So maybe you're afraid to leave the house because you're worried about having an accident. Maybe you're afraid to eat different foods and so you stick to the same old boring foods week in, week. One of the reasons I talk about regular meal times a lot is that we know a starving brain or somebody who's undernourished or malnourished, not eating enough food, will be much more likely to have obsessive thoughts, to feel more anxious, and to ruminate, so like go over things again and again. And this can be quite common when you have had bad digestive experiences. then you tend to eat less or cut out meals, and then you might be getting lower in key nutrients that are needed for good cognitive function. And it can physically be driving some of those symptoms of worry and anxiety. Now, I'm totally not saying that anxiety is driven by nutritional deficiencies, but it can be a contributing factor to obsessive thought patterns. If you think about that kind of cave person brain that I mentioned before, what the cave person brain is hearing, we're in a famine. We need to be on the lookout. We need to be hyper vigilant. We've got to see more danger because there's a sense that the body is not getting fed. Some of the behaviours that you might notice is constant body checking, so constant looking at any small change to your bloating, always thinking about your digestion. Any small gurgle can really set off a feeling of panic for you. You might also have restricted your food down to a small handful of foods that feel safe or allowable, maybe just 8 or 10 foods that you can eat week in, week out. And you would feel physically nervous and scared to experiment with anything outside that safe range. The fight or flight response can be triggered from feelings of anxiety, such as having to do something a bit scary, like having to go on a long train journey and you don't know where the toilets are going to be, and that can be very stressful. Or if you have to eat food, you don't know what's in it. These can definitely be fear-inducing, and we know then when you have that fight or flight response, you're likely to have less stomach acid production, less digestive enzymes, less motility, so your food can sit quite heavy in your stomach. You can feel a bit more sick and that food is just not digesting well, or you might be evacuating your bowels quite quickly in that kind of readiness to meet the danger. So that's a very common response to fear and anxiety. It's very similar to when people feel really angry. When we're really angry, and this can also be quite common with people who have IBS, underlying anger, and it comes about from thinking, why is this happening to me? This is so unfair. A lot of people I've worked with have said they end up resenting people who can eat healthily, eat normal food. But did you know when you feel that anger, you have that strong sense of anger, it gives a similar physiological response to feeling scared. It can sometimes trigger that fight or flight response because when we are angry, we are also triggering the release of cortisol, adrenaline, and that really gets you kind of fired up. And so you might have the same physical experience of anger as you would if you were feeling very scared. We also know that when you're tired and run down, you tend to be more irritable and be quicker to anger. Also, if you're in pain, anger is more right there under the surface because you're already dealing with significant pain, and it means you're more likely to snap out at your family. But anger can also be quite a difficult emotion, and some people feel guilty for feeling angry and so will suppress the anger. So I was really interested to read in a study recently that actually suppression of anger can delay your stomach emptying and also can slow down your gastric transit time. So slow down the amount of time that food takes to get through your body just because you are suppressing so many emotions. And if you think about it, you're kind of holding yourself quite tense when you're doing that, and you might not even notice. This can be quite common, particularly women, I think, are not often allowed to show anger. When we're pushing down anger, there are sometimes physical consequences in the body when we have these feelings, but we can't acknowledge them, we can't show them. So the next sort of difficult emotion I wanted to talk about with IBS is embarrassment, and this can come a lot from shame about our body, shame about the noises that you make in the bathroom, maybe the smells that you make within your house. You might feel embarrassed and you might feel like there's something wrong with me, like there's something defective. Why is this happening to me? There must be something wrong with me. I should be able to sort this out. I should be able to manage this. Why can't I deal with it? So there's a kind of sense of embarrassment about the actual symptoms, but then also in some way like a level of embarrassment or shame that you haven't been able to resolve it. And often people will say that to me in the discovery calls. It's like, oh, I feel like I should know what to do. I should know how to manage this. The other sort of difficult emotion strongly related to IBS is depression or low mood. And that might come across as, an obvious sign of depression, which would be feeling very lethargic, feeling sad, crying a lot, not wanting to engage, socially withdrawn. But you might also see something that's just general low mood. There's something called anhedonia. So hedonic is like pleasure seeking, enjoyment and being driven by pleasure. Whereas anhedonia means that you don't really feel any pleasure. And so I sometimes see this in my clients. It will be where you don't necessarily have depression, you don't have something clinical that needs dealing with, and at the same time, you're just not really quite happy. So you're not necessarily feeling good and feeling upbeat. I think some of that feeling can be situational. So it might be down to the fact that you don't really have any time for yourself, that you're always feeling under the weather, that you're just feeling a little bit off all the time. And that can be really difficult to deal with, even though it's not classed as clinical depression. These kind of personality traits and emotional patterns, like the way that you feel these different emotions, can affect your immune system, inflammation markers, your hormones, and also the way that your nervous system works. So if you're someone who has neuroticism, which is kind of a general negative outlook, likely to be worrying a lot, catastrophizing, then you might feel the symptoms much worse, and you might also feel the threat of symptoms to be worse than someone who doesn't have this neuroticism trait. These negative emotions are all tied up with actual physical chemical changes in our body that actually have an impact on how digestion works and all the symptoms that actually characterize irritable bowel syndrome. Whilst I've been naming all of these different emotions and character traits and things like that, I wonder how easy it is for you to identify with those feelings. There is something called alexithymia, where people really struggle to identify their own emotions. They find it hard to identify their feelings to themselves and also to know how to describe how they're feeling. Someone with alexithymia, for example, would struggle to know the physical sensations associated with a certain emotion. And they may struggle to know whether a symptom of IBS is a physical change or whether they're actually feeling an emotion. There is some research saying that the prevalence of alexithymia in people who have IBS is somewhere from 50% to 2/3, and that's with people who've got other functional digestive disorders, not only IBS. But it can be quite common, and that's why I wanted to talk about it today while I'm talking about negative emotions. It's just that there is this subsection of people who have IBS, and it may be more common than we think. People who really struggle to identify their emotions and also to understand whether they are feeling an emotion that is difficult and upsetting and painful, or whether there is a physical change that is happening and it's a physical symptom. Now, as I've mentioned already, there are a lot of emotions which also bring up a physical chemical change and a structural change to our body. So we know that there are changes in the body when we feel some of these negative emotions that don't necessarily happen when we feel positive emotions. Some of the things you might like to do is to try and describe to yourself or to a close friend or partner what the different physical sensations are of having these different emotions. Like, where in your body do you feel anger? Where do you feel fear? And what kind of symptoms or what kind of physical changes do you get when you are feeling scared? Maybe you're getting butterflies in your tummy, your mouth might go dry, those kind of things. Or when you're feeling very depressed, maybe you have this brick in your stomach that feels heavy, and it might be associated with an emotion rather than your digestion. When we can understand a little bit better the difference between what's happening on an emotional level and the changes that is making, and then what is being caused by the food that you're eating or the way that you're eating, we've got an opportunity to make some changes. The one thing that we do know from the research is that people who have this alexithymia, this inability to properly understand their own emotions, tend to have higher levels of clinical anxiety and worse quality of life. So some of the emotions and things that I've talked about this week are caused by having IBS. They are because you are limited with your food. Your social situations are reduced because you're worried about eating. You maybe are not getting on well at work because you're so tired, because you're not sleeping well, because you've got gas at night. So some of these things are caused by having IBS. Some of them, the emotions, are causing digestive changes. It's this two-way street between the gut and the brain. We cannot get away from this. The way that we feel has got an impact on our digestion, and obviously we have emotions about our digestive health and the situations that it is creating or affecting. If you're feeling that you've got a lot of emotions about IBS, then some of the best things you can do is to talk about them. I often recommend my clients go to therapy and work with a counsellor or therapist, because when we are able to work on the emotions and a lot of the emotional drivers alongside working on your diet, you've got a much better chance of getting the digestive symptoms under control. Therapy is a very important part of recovery for a lot of people. I don't want to underestimate the work that is needed in order to live with some of these feelings. That's why working with a therapist is so important, because they are able to hold the space for you to feel these feelings and do it in a way that doesn't leave you feeling worse. Definitely talking therapy would be my number one recommendation for anybody who this is striking a nerve with. The second thing was that it is okay to feel these feelings and to be okay with having emotions. Sometimes we have been brought up to feel we should feel guilty for feeling angry, or perhaps you grew up in a house where anger was expressed too much and you try not to be angry now, so you suppress it. Or maybe you try to be upbeat and happy all the time, even though your digestion is really getting you down and you are very fed up, but you try and put on a brave face for other people. You know, these things are hard to carry when you feel angry and you can't express it, or you feel very embarrassed or shameful about the condition that you have and you're not able to talk it through. So firstly, the talking, but secondly, just knowing that it is okay to feel some of these things, but it's actually how you are able to feel the feelings and then move through them. Often by suppressing them, we tend to experience them even worse over time. So this is where things like journaling can be really helpful, to just write it out. If you don't have access to a therapist, just writing it to yourself. How do you feel about it? What's changing? And trying to really get to the bottom of where these feelings have come from. And then other more practical things that you can do. I know you might well have heard about a gratitude practice where you will just every day write down 3 things that you are grateful for. I've started introducing this with some clients as well, although it's kind of outside the scope of IBS, but I feel that it has a benefit in just helping you see that not everything is bad and not everything is terrible, because there are good things in most people's lives if we can just find them, and they might be small, so small that it's like, I'm grateful that it was sunny this morning because I enjoyed walking to work and it wasn't raining. Feel more gratitude. You're able to feel better about the world and actually about your hope of regaining your full health. So that's helpful. Other more practical things that you can do would be getting out into nature, so going for a walk, particularly any time where you can see the trees, get into the grass. Like, seeing nature is very transformative and very helpful. I know that's very hard if you feel like you can't leave the house for too long and you're worried about getting outside, or you sometimes maybe feeling scared of leaving the house. These can be really challenging, but even if you're just able to sit outside in your garden for 10 minutes, getting outside, some fresh air. If you have a pet, then definitely stroking a pet can be very helpful and therapeutic. And then also just talking to friends and family as much as possible and trying to open up. Normally that's best when you have been able to do that with a therapist first, to kind of get things straight in your own head and try and work out how you're feeling, and then build from there to reach out. But definitely social connections, trying to maintain social relationships Because the more time we spend in our own heads, the more we can sort of spiral into some of these negative emotions and it can take over. Unfortunately, scrolling through Instagram or looking at YouTube doesn't really have the same effect as chatting to people. But of course, people do make good online connections that can be helpful. But spending time with some people, some real friends who are there in real life, can be more transformative. So that's been a slightly different podcast topic this week, something to think about rather than anything to put into practice in terms of educational tips that you can go off and do, but just something for you to think about, really. Thinking about how your emotions influence your digestion also influencing your emotional state. I'll leave it there for this week though. Thanks for listening to this episode of The Inside Knowledge. Better digestion for everyone.